Welcome to the tutorial on how to complete the ACHA Institutional Profile Survey, or IPS. Every member school receives an email inviting them to participate in the Institutional Profile Survey. The email is sent from Qualtrics to either the RMI or the survey contact, if one is designated for your institution. The email will have some important information, including links to the IPS fillable worksheets, a link to IPS definitions, important next steps, and a unique link to the IPS for your institution. The IPS is organized into two sections, Section A and Section B. Section A asks about services, number of visits, staffing, and budgets from all facilities, units, organizations whose primary mission is to provide medical, mental health, or health promotion services to students. Section B collects campus-wide information about policies, services, student health insurance, and immunization requirements. It's important to use these worksheets first to collect the required information. When all the data is collected, use your institution-specific Qualtrics link to enter the data and submit your IPS. Definitions can be found throughout the Qualtrics survey and are identified by a blue font with a dotted underline. Simply hover your mouse over the word to display a pop-up with the definition. A PDF of all the definitions can also be found on the ACHA website. If your institution filled out the previous academic year's IPS, all numeric data will be provided side by side with space for this academic year's data. All single-select, multiple-choice questions are also pre-populated, but please pay careful attention to the responses we pre-populated to ensure the accuracy as it pertains to the current academic year. Please use caution when using the back button with pre-populated multiple-choice questions, as any changes you made for this year will be lost and revert back to last year's responses when the page reloads. If you do use the back button, please carefully double-check that all values entered for pre-populated multiple-choice items are correct for the current academic year before proceeding to the next page of the survey. This is where using the fillable PDF worksheets is helpful to keep you from going back in the survey. Some other important things to note about the IPS are: Number 1, skip logic and display logic are employed throughout the survey, so not every question will be visible to every institution. Number 2, psychiatric care has been separated from the mental health services section. Number 3, FTEs are organized by department. However, some positions may not line up with how or where your institution hires them. Please be sure to review the PDF worksheet to determine where the positions are listed. Number 4, all questions require a response to proceed through the survey. If an answer is not selected or entered before moving on to the next page, an error message will appear asking you to please answer the question. Here is an example of a numeric question for an institution who did not complete the previous year's IPS. Notice that the box on the left is blank and shaded, so you cannot enter a value. The value for the current year should be entered in the box on the right, where it says Enter New Value here. For most numeric questions, please enter -9 if you do not know the answer, rather than guessing. For FTE questions, please enter 0 if you do not have an FTE for a particular position. Hint, you can use the Tab button to quickly move through the FTE positions in the survey. It is important that you read the instructions for each question. Qualtrics does not automatically calculate totals. The instructions include a guide to ensure that the answers per row make sense and that they match with the total count. Please be sure to check all your answers. Once you are done and have submitted the IPS, your responses will be recorded and you will not be able to go back to edit your survey. You can download a copy of your submissions by clicking the Download PDF link after you click the Submit button. Finally, some important dates to keep in mind. The deadline for submission is December 31st. We cannot accept late submissions. Renew your institutional membership by December 31st to ensure you get access to the Data Hub. Information about Data Hub access to new users will be sent to the RMI in January. Current Data Hub users will continue to have access if the IPS is submitted by the deadline and institutional membership is renewed. New IPS data collected at the end of each calendar year will be integrated into the Data Hub by the second quarter of the following year. Thank you for your participation in the IPS. Your contribution will allow for a more robust, representative dataset in the Data Hub. For questions about the IPS or Data Hub, please email us at ktanabe@acha.org or visit us on our website at www.acha.org/data-hub.